Hello, ladies. My name is Jaylene Sims, and I'm a medical student at Southern Illinois University School of Medicine. Welcome to the Love Your Life series. Today we're going to talk about breast health. The lesson is entitled Ta-Ta Talk. Here's the outline for today's talk. First, we'll talk about the facts and myths of breast cancer. Next, we'll discuss breast anatomy and the most common types of breast cancer. Then we'll discuss the symptoms of breast cancer. Then screening methods for breast cancer. Next, we'll talk about the risk factors and ways to prevent breast cancer. And last, for those who do not have insurance, we'll discuss how to get screenings. Here are the facts. Breast cancer is the leading cause of cancer among women, and it's the second leading cause of cancer deaths among women. Just in case you're wondering, lung cancer is actually the leading cause of cancer deaths, and it's among men and women. Here's another fact. More white women actually get breast cancer than black women every single year. However, more black women die from breast cancer every single year, and that's what you would call a health disparity. Health disparities just means like deaths or incidents of diseases that happen in disproportionate numbers. Now, it's thought that it is a health disparity due to late detection for whatever reason, meaning they're not getting their screenings or they're just not being found. And also, it's because of them contracting more aggressive cancers than other women. Now that we've talked about the facts, let's talk about some of the myths of breast cancer. And this is very important for women to know just because a lot of women, get afraid about these types of things that we're going to talk about. So let's go ahead and do some myth busters. So the first one is finding a lump equals breast cancer. This is not true. Lots of women have what we call lumpy, bumpy breasts. If you find a lump that stays for a few months or changes or causes abnormal pain, that's a sign that you should talk to your doctor. But for the most part, lots of younger women have what we call fibrous breasts, meaning that they're just very thick and they change throughout the month. And sometimes you'll notice the changes around your cycle. So that's just, it's not true. Just because you find a lump does not mean you have breast cancer. The next one is birth control can cause breast cancer. This is not true. Birth control has a hormone called estrogen in there, and estrogen sometimes is one of the hormones that feeds breast cancers. So in this regard, it can raise your chances. It only, like I said, raises your chances, but it doesn't cause it. And it's only while you're taking them. So as soon as you stop taking your birth control that has estrogen in it, you decrease your risk back to the normal population. The next one is breast implants cause breast cancer. This is not true. However, it may make it more difficult for someone to feel that they have a lump, so therefore it becomes a little bit more difficult to detect. So that's something you want to just kind of keep in mind if you do have breast implants. The last one for the slide that we'll talk about is if you have a family history, you're going to develop breast cancer. Well, that's not true. I know lots of people have heard about the BRCA genes, and you may have heard of even Angelina Jolie. She got the mastectomy, meaning she's gotten her breast removed because she had that gene. But you have to think about the family history and the genes that are involved. We'll talk about those a little bit later in our discussion. But overall, people who develop breast cancer, only 10% of them actually had a family history. So that lets you know that 90% of breast cancers aren't necessarily due to a family history. So that's something you should just keep in mind. Always be aware of your family history, and that might change when you start getting your screenings. But just because you have it doesn't mean that you're going to get it. So that's something to just kind of tuck away in your mind, and don't be alarmed when you find that someone in your family has breast cancer. Let's talk about the breast anatomy. So, our breasts, they're made of fat, blood vessels, fibrous tissue, like we talked about before. Fibrous tissue just means kind of the dense, kind of thick tissue. And it's also made of muscle, like our pectoralis major and minor muscles. Let's talk about inside the fat, and you can kind of see in the middle of the screen where you see the lobe and the duct. The lobe is actually where the milk is made, and the duct is what connects the lobes of your breast to the nipples. So it's just kind of like a little bit of a passageway. Then you also have lymph nodes, and that's what kind of drains your breast tissue. And something to note here is that when someone gets breast cancer and it spreads to the lymph nodes, that actually allows it access to the rest of the body. And so that's the reason why sometimes when a woman has breast cancer, they also survey your lymph nodes just to see if you have any of those cancer cells in those. And if so, they'll just remove them. Now that we talked about the anatomy of the breast, it's a good segue into the different types of breast cancer because um, these are sometimes based on the anatomy of the breast, so it's good to kind of know those together. So they're classified based on two things, where the cancer began, and then two, if it's traveled from its original site. So let's talk about first the sites of breast cancer origin. If it began in the lobules or the milk lobules, it can be called lobular carcinoma, or we can just call it lobular breast cancer. Now, let's say that it starts in the ducts, which, as we said before, is between the lobule and the nipple, the little passageway. Say the cancer starts there, then we'll call it ductal carcinoma or ductal breast cancer. And this one here is actually the most common type. So there's a few others. You can have breast cancers that start in the fatty tissue, the fibrous tissue, or the blood vessels. These are pretty rare. And then you can also have some that start in the lymphatic vessels, which we just showed you on the last slide. It was depicted in the green. And so if it happens here, the tumor is going to block the vessels, and then it can be called inflammatory breast cancer, and that's actually one that's pretty rare, but you may see lots of African American women that have that more so than other women. So to continue our discussion about the different types of breast cancer, let's just talk about the difference between invasive and non-invasive breast cancer, meaning has it traveled from the site of origin? If it has, then we will call it invasive. And if it's still in that site of origin, then we don't say that it's invasive. So here's the terminology we use for ductal carcinoma. We would say invasive ductal carcinoma. That's if it starts in the ducts and it's traveled to other places of the body or other places of the breast tissue. Or we can say it's invasive lobular carcinoma, meaning it started in the lobules, but it's traveled to, say, for instance, the duct. Now, if the cancer has remained in the same site, that means it's non-invasive, and so we use the term in situ. So we'll call it ductal carcinoma in situ or lobular carcinoma in situ. So here I've actually posted a video that kind of provides a visual of those different types of cancers. It's very short, and if you'd like to take a look at it, just go ahead and copy and paste this link that's at the bottom of this slide into your browser. And it's very good. It's very simple and easy to understand. Now let's move forward and talk about the symptoms of breast cancer. Now I know we said before that it was a myth. If you find a lump, it equals breast cancer. That's very true. There are lots of women that have, like we said, lumpy, bumpy breasts. However, it is one of the most common symptoms or signs of breast cancer. So if you find a breast lump or thickening that feels different than the rest of the surrounding breast tissue, that's something that you might want to watch for a while or go ahead and tell your doctor about. Likewise, bloody discharge from the nipple, as you can kind of see from this picture on the right side of your screen. Change in the size or shape of your breast, which you can kind of see in the picture with the circle, that retraction or indentation of the nipple. That's kind of a change in the size or shape. Or sometimes you may see one that actually gets a little larger or redder. That would be a sign of breast cancer. Sometimes you might even see a orange looking color, almost like an orange peel. Likewise, an inverted peeling, scaling, flaking nipple, or skinned surrounding the breast. Those are all different things that you can kind of look for when you're doing your self breast examination, or that your doctor will look for when your doctor is doing your clinical breast exam every year. So just be aware of those symptoms of breast cancer and let your doctor know if you start to feel any of those. Now, something that's actually not mentioned on the slide, but these are symptoms of cancer in general. If you start to see weight loss, nausea, vomiting, things like that, things that you may see in any type of illness. Those could be signs of cancers in general. And then if you start to notice them with these symptoms of your breast, it could be breast cancer. So just be aware of it, not to alarm you, just be aware. Here are some screening methods for breast cancer. We'll start off by talking about breast self-examinations. This is pretty controversial right now because a lot of women are starting to find lumps in their breasts because they're checking their breasts, and they don't realize that, as we talked about before, sometimes you have lumpy, bumpy breasts, and so you get really nervous and you go to your doctor, and then you're kind of like spending lots of money on unnecessary tests and things like that. So that's the reason why we say making sure that you become familiar with your breasts. That way, if you find something that's out of your norm, that's when you go to your doctor. So that's one thing that I want to just make sure that I really instill in you today. Be aware. I'm going to read this verbatim. You will notice changes throughout your monthly cycle, especially younger women, because your breasts are more fibrous, meaning containing thick tissue, than sometimes older women. And as we kind of discussed before, it's due to the estrogen in your body. So let's just kind of go through this. Throughout your monthly cycle, with day 1 being the first day that you actually bleed, all the way through, let's just say day 28. Day 1, you're going to have a lot more estrogen from then all the way up into, I would say, day 14 than you will from 15 through 28. So therefore, your breasts are going to be a little bit more tender and fibrous or thick through the first half of your cycle than you will the second half of your cycle. So that's just something to be aware of. I would say just pick a day every month and check your breasts, or you can do it every single day, however you want to do it. You can do it in your shower or do it laying down. Just make sure that you have a mechanism that you use to check your breasts. Now I want to take your attention to the picture on the right side of your screen. The first one shows that this woman is examining her breast in the shower, and as you can see, she has one arm raised and with the hand behind the head, or you can kind of put it on your forehead, either way, and then you use the opposite hand to go across your chest and check that breast. And you want to go into a circular formation around your breast, starting with the outermost part, going all the way into your nipple, and then you squeeze your nipple at the end just to see if there's any discharge that comes out, and then you'll switch and do the other side. So that's how you do what we call palpation, or pressing your breast. So then the next step you would want to do is to just stand in the mirror. Stand with your hands down to your side, raise them, put them on your hips, and see if you notice any dimpling, redness, flaking. You just want to make sure you have a good visual inspection of your breast. And then lastly, go ahead and lay down and you can do the same thing. Now, you may not do all of these every single time. I say anytime you check your breast, that's excellent. It's much better than not checking them at all. My thing is just make sure you become familiar with your breast. That way, when you find something that's out of the norm for you, that's when you go and you speak to your physician about it. Here are some more screening methods for breast cancer. So your clinical breast exam, which we kind of mentioned before, this should take place annually. At this appointment, your doctor will note any changes or not that they've noticed from the previous year. And this here is a great time to ask questions about your breast health, any concerns that you have, or if you want to discuss when you'll start your mammograms or things like that. So mammograms will be the next screening method that we'll talk about. A mammogram is just an x-ray of the breast. It's recommended that all women begin at age 40, no matter what your race is. And it's important to note, if you have a family history of breast cancer, you should speak to your doctor because they may want to actually start sooner. Because if you had like a mother or a sister that had breast cancer at age 35, it'd be better for them to start your mammograms a little sooner than someone who doesn't have a family history. So always make sure you let your doctor know if you have a family history of breast cancer or any other disease for that matter. So the last mechanism we're going to talk about is an ultrasound. An ultrasound is very similar to a sonogram, so that may ring a bell for you if you've ever had a baby or if you've known someone who had a baby before. Basically, you use a probe that you press to the tissue of your breast and it projects an image of the breast onto a TV screen. That's what it is. These are actually used for younger women when an area of concern arises. Ultrasounds allows you to visualize the breast even in the event that you have very fibrous or thick breast tissue. Sometimes mammograms don't allow you to see the breast that you want to, so therefore for a younger person you may use an ultrasound instead. This is the last thing about screening that I really want to drive home. Early detection is key. Using all of these methods are very important for early detection. Early detection equals a better chance of cure. So just remember that. Always do your self breast examinations. Then every year when you go see your doctor, make sure they are doing your clinical breast exam. And then when you turn 40, make sure you start your annual mammograms every year. Now we're on to our discussion about what causes breast cancer. This is actually going to be a little bit more complex, but I'm going to try to break it down to a level that's a little bit easier to understand. So we all have DNA, which basically sets up our genetic code, how we look, how we act, all of that is kind of in our DNA. So our DNA codes for the different types of cells in our body. So like some of our DNA codes for us to have a fingernail, some of our DNA codes for us to have an eyeball, some codes for us to have hair, and so that's why I say DNA codes for us to have different types of cells in our bodies. So, along with the DNA, you have proteins that work very closely to the DNA, and it regulates how often those cells divide, and it also regulates the cycle. So when DNA gets damaged, it stops the growth cycle and allows for DNA to be repaired. Now, it's very common for our DNA to actually be damaged when it's in the cycle of replication, meaning dividing, and that's why we have those helper proteins that I just kind of mentioned. So when the DNA regulators are damaged, the cells just kind of divide as they please. They do as much as they want to. They don't have any signals that tell them to stop, and they start to pile up on each other. And that's what you call a tumor. So now let's move on to the BRCA genes that everybody just so lovely talks about. The BRCA1 and BRCA2, those are genes that code for regulator proteins. And these actually help fix DNA when the DNA gets damaged. Now, when these genes are mutated, or meaning they're damaged or something's wrong with them, there's a greater chance for someone to have breast or ovarian cancer. It actually increases a person's risk 10 to 30 times than someone who doesn't have that actual mutation or damage to those genes. So, here are some of the risk factors for breast cancer. Being a woman is the number one risk factor for actually developing breast cancer. Um, we as women are more likely than men to develop breast cancer. Getting wiser or increasing in age, that's another risk factor. And as we kind of said before, family history and personal history is a risk factor. So if you've had breast cancer once, it's a possibility you have a higher chance that you'll develop in the opposite breast. Um, so that's something you want to just kind of keep in mind. If you've had it before, it's a possibility that you'll develop again. And then we said family history, and just remember only 10% of the women that actually have breast cancer had a family history. So it's not just crazy likely, but it is an increased risk. And then, as we discussed on the last slide, the BRCA1 and BRCA2 genes. So, say you have just a mutation in the BRCA1 gene, then you'd actually have a greater chance for developing breast cancer or ovarian cancer. And this is for women. Now, say a person has a mutation in the BRCA2 gene, well, that's actually more common for men to have breast cancers. And yes, it's common. Men can have breast cancer. Actually, it's not common, but it is likely to happen. Some more risk factors. Radiation exposure. Actually, radiation exposure is one of the risk factors for lots of cancers. But for the sake of our talk right now, it's a risk factor for breast cancer. And then, as we kind of discussed before, increased exposure to estrogen. So we'll just go through this list of things and talk about these different risk factors for increased estrogen. So, obesity. What obesity does is you actually have increased number of fat cells in your body, and those fat cells actually cause your body to develop more estrogen. And of course, if you have more estrogen, then you're more likely to develop breast cancer. So, starting your menstrual cycle before the age of 12. So, nowadays, lots of young girls are starting their menstrual cycles at the age of 8, 9, 10, 11. And because they have a longer exposure to estrogen over their lifetime, then they have a higher chance of developing breast cancer. Another one that's kind of related to that, or not necessarily related, but kind of on the same lines of that, is late menopause. So, say a woman actually starts menopause at the age of 50 compared to someone who starts it at 60. The one who starts it at 60 has a longer exposure to estrogen, therefore increasing her chance for breast cancer. Another one, having your first child after the age of 35. So let's explain that. During pregnancy, estrogen is actually decreased, and another female hormone is called progesterone is actually increased. Progesterone is the hormone that actually helps sustain your pregnancy, and estrogen is the hormone that will actually either abort the baby or help you start with your contractions when it's actually time to have the baby. So it would only abort the baby if you had too much before it's time for the baby to be born. Another risk factor is having never been pregnant, and this kind of goes with the previous one that we talked about. Having never been pregnant means that you'll have an increase exposure to estrogen over the period of your life. And then the last one that we'll talk about regarding estrogen is postmenopausal hormone therapy. A lot of women have hot flashes and things like that, and estrogen replacement is used to kind of help with the heat flashes. And so as we talked about earlier with the birth control, it's only a risk factor while the hormone is being taken. As soon as the hormone is stopped, the risk factor that you have actually goes back to the normal population. So your risk for developing breast cancer is not increased if you're not on postmenopausal hormone therapy. And the last thing is drinking alcohol. That will increase your risk for breast cancer. So we've talked about risk factors. Now let's talk about how you can prevent breast cancer. Most of the risk factors are non-modifiable, which means like your family history. You can't choose your family. Your genetic makeup, you can't choose that. Your gender, women, as we said before, it's more common for women than men. We can't choose our gender. We can't choose whether we're going to age or not, although lots of us would like to. We can't choose whether we get older or we get wiser, as I like to put it. However, there are some modifiable risk factors that will help you prevent or decrease your chances for developing breast cancer. So, on the last slide, we said that alcohol intake will increase your risk. So, if you try to limit how much alcohol you have, as we say, moderation on everything. You always want to have things in moderation, and then it's not too bad for you. So, limit your alcohol take. Exercise most days of the week if possible. If you can exercise 3 to 5 days out of the week for at least 30 minutes at a time, and I always like to tell people, work your way up to 30 minutes. I know that it's difficult to start at 30 minutes, but if you can do in 10-minute intervals or 5-minute intervals and work your way up to 30 minutes, that's the best way to help your body to get used to extraneous exercise. The next one is eat a well-balanced diet. And I won't really go into that too much on this PowerPoint, but if you look at the Love Your Heart PowerPoint, it has a great slide on diet. So I would encourage you to take a look at that one. And then weight management. So, as we said on the last slide, obesity is one of the risk factors. So, weight management is very important in all of the things that we talked about so far, as far as the alcohol, exercise, and the diet. Those will all help you with your weight management. The next thing is to decrease the amount of unnecessary radiation exposure. Of course, sometimes you may have to get x-rays or CT scans and things like that. However, if you don't have to be around radiation exposure, try your best not to, because then you can decrease your chances of developing any type of cancer, and for the sake of our discussion, breast cancer. And then lastly, try to decrease the amount of postmenopausal hormone therapy. So you're probably wondering, how can I get these screenings if I don't have insurance? Well, no fear. I wanted to make sure that all women have equal access to mammograms or ultrasounds if it's necessary. So I provided you with this information here. The Susan G. Komen Foundation is a prominent organization that is out there willing to assist women with mammograms or ultrasounds if it's needed. So you can just call this phone number. It's 1-877-GO-KOMEN, and you can find out where they've provided grants in your area to actually provide these screenings that you need. So just give them a call, or you can go to their website and they can help you out with that. Another one is the National Breast and Cervical Cancer Early Detection Program. I've provided the link to their website right there. It's through the CDC website, but it's a link to that. Take a look, and you can also find out where you can get mammograms or ultrasounds that you need. And then another suggestion would be to just go to your local or your state health department. They are aware of all the local breast and cervical cancer screening programs. They can kind of guide you to what you need for any type of screenings you need. So I would just say make sure you keep them on speed dial if you need help. And then the last suggestion that I have is to just ask your doctor or a local health resource person in your area. A lot of people that are kind of in tune to these things, they have no problem sharing the information that they know about the programs that are available. Those programs are out there, and sometimes they're underutilized. And so if you just find out from your physician what type of programs are available, these programs are ready, they're willing, they're up and running, and these people really want to help you. So, last, here's the charge. As I always say, each one teach one. Today, you have learned more about breast cancer, and now it's your responsibility. Please teach your moms and your cousins and your sisters and your friends, your aunts, your grandmothers, your daughters, women helping women. That is what's important. You've learned this information. Now it's time for you to teach someone else. Do you have questions? If so, you can email me at jaysloveyourlife@yahoo.com, or you can visit with your doctor. Now, this information is not to be substituted for advice that you can actually receive from your doctor. It's just supposed to be used as a probe, just something that will allow you to think about something that you need to talk to your doctor about. And these are the resources that I use. You can always go to those websites and look up more about breast cancer. Mayo Clinic, the National Breast Cancer Foundation, Susan G. Komen, and the Centers for Disease Control and Prevention. Thank you for tuning in.